Welcome back to UrbanMD TV. It's Dr. Lauren Powell, your board-certified family medicine physician, also known as a culinary doctor.
And I'm Dr. April Spencer. I'm your board-certified surgeon and founder of Dr. Spencer's Global Breast Health and Wellness Center. And we're the co-hosts of UrbanMD TV.
Now listen, after a long day of work, running the errands, doing the activities, it's not uncommon to want to lay down and get some shut-eye.
For sure.
We're here to share with you. Listen, there's no shame in that if you choose to do so, because burning the candle at both ends is a no-go. It's not cute anymore. And that's why we're diving into the astonishing world of sleep.
Ooh.
Dr. Spencer, did you know that only 1 in 3 adults don't get enough sleep?
You know what? That is an astonishing statistics, but I can believe that.
How much sleep do you get a night?
Not enough.
How many? You're a surgeon, you're a mom. About how many hours would you say you average a night?
I would say about 6,
Okay.
solidly.
6, and do you feel rested when you wake up in the morning?
I mean, I get through the day.
Okay.
I get through the day. And that's why I think it's important that we're having this conversation, because it clearly is not enough. Sleep deprivation is a chronic condition. It affects so many Americans,
goodness, so
and
many.
it can lead to so many health issues.
Yeah.
Obesity, cancer, cardiovascular disease, diabetes. And did you know it even affects our longevity?
Yeah.
There's studies that show that people that don't get adequate rest don't live as long.
I believe
So-
that. I mean, I have patients who I cannot control their blood pressure. I throw everything at them. I throw all the medications, and their blood pressure will not move, and it's usually their sleep. And I can
Wow.
usually tell. It's usually that bottom number. Like, why isn't your bottom number moving? And usually
It's the sleep.
it's their sleep.
Yeah.
So that's great. It's good. Listen, that's why we have today joining us all the way from Saginaw, Michigan.
All
My
right.
brother, Dr. Christopher Allen, a sleep medicine physician and founder of the Quality Sleep and Neurology. Welcome back, Dr. Allen, to the show. We are so glad that you're here.
I'm glad to be here, ladies. Good seeing you again. And doctors, I just love the experience. I love that you're talking about sleep. I love that we're diving into this. And I feel like we're going to give some information where we can get these people to get, some good quality sleep.
Yeah.
Now, what do you think? There's such like this culture of like, if you can do all the things without sleep, like you're winning.
The
Right?
sleep
Like,
is like shunned upon. Like if you are sleeping, you're considered
like
weak.
lazy or
Yeah.
like, why do you need sleep? You should be able to just get it all done with no sleep.
Yeah.
Yeah, and see, the thing with that, a lot of people, it's like this whole hustle culture.
Yeah.
Like if you're not grinding, if you're sleeping, you're not grinding, you're not winning. And honestly, it's to the contrary. People have had lots of studies to show that if you get quality sleep, you actually get better performance.
More effective.
You get better outcomes. And the hard part about this, and this is why I love treating people with sleep disorders, the first thing that goes when people are trying to do something is sleep. I've been affected by that myself. Back in med school, when you want to study for that test, what do? You stay up late.
All
People-
night.
Yep. People in college, it's like, I got to pull an all-nighter. But the thing is that honestly, when you're sleeping, your body's recharging.
Yeah.
That's when you consolidate your memories. So the things you're studying
Yeah.
gets better memorized because of that.
Yeah.
And that's so true. And I'm glad you mentioned that, because I used to feel like sometimes I would go to sleep in med school and I would be a little bit confused about a topic. And I was like, I just need to go to sleep. And I would wake up with so much more clarity. Like I literally had a better understanding of what I studied the night before after going to sleep.
I know I get about 6 hours of sleep consistently. I've always wondered, is it the quality or the quantity of sleep that matters most?
And I'm glad you brought that up because I think it's a little bit of both. Because the thing is, and I always tell patients this, and I'm telling you guys as well, Mr. Sandman wants his money. And how do you pay him? You pay him by like going to sleep. And then it is about that quality of sleep too, because once you're sleeping, it's about what happens when you're asleep. And the best person to answer that question for you, if you're fortunate enough to have a bed partner, ask them a simple question like, how am I sleeping? And it's eye-opening. A lot of people, and I see that in my clinic, I have them fill out a questionnaire, and they're like, wait a second, you didn't tell me I snore.
Right.
Or they might pause in breathing,
Yeah.
or even like punch or fight in their sleep. And the thing is, for this whole hustle culture, like you have to rest. Because even if you don't have a sleep disorder, it can actually act like you do. And so they've shown studies that people that are getting lack of quality of sleep can still lead to high blood pressure, like you were mentioning earlier, cardiovascular disease, and even stroke.
Thanks, Dr. Allen. You're so smart. You're so
Takes one to know one.
Thanks for clearing some things up. I think that sheds light on sleep, and it's not something that we should mess with. It's not something we should take lightly. It can really be a window into our health. So I thank you for really sharing that information.
When we return, we'll meet you at the bar where Aja Wolf, owner of Atlanta's premier mocktail lounge, The Sober Social, is prepping one of her signature non-alcoholic concoctions. Then later, we'll journey to Midtown Manhattan, where Dr. Chuck Morris is revolutionizing science-based treatment designed to foster a pain-free life. We'll be right back with more UrbanMD TV.